Welcome to Boomer Being. Many of you have experienced pain. Pain from injury or pain from a variety of conditions such as arthritis. Today, as part of our series in health and wellness, we're going to explore how exercise can be part of your strategy to get well and eliminate pain. My guest today is Donna Schneider. Donna is a clinical exercise specialist. She has a master's in exercise physiology and is a member of the Council on American Exercise. Donna has 23 years of clinical exercise. Her clients range in age from teenagers to a 95-year-old, but the big majority of her clientele are baby boomers. So sit back, stay tuned, and find out how you can use exercise as part of your healing strategy. We're going to have an extra special treat. We're going to see a demonstration with an actual client. Welcome, Donna.
Thank you, Leslie. It's a pleasure to be here today.
So happy to have you.
Delighted.
Tell us more about your practice.
Well, Leslie, 4 years ago, I decided that there was a need to bridge the gap between the typical medical model and physical therapy and treatment in clinics, and transitioning that person into a home exercise program or whatever kind of exercise they felt they needed to do or not to do. So I established the business 4 years ago here in Andover, Pillar Healthcare, and I see people that have a need and need to be supported through post-PT, pre-PT, we can call it prehab even, who have arthritis, typically injuries to joints, plantar fasciitis. I see people who have across the board back issues, disc issues, all the way up to spinal stenosis. I also treat and see people with metabolic disorders, multiple sclerosis. I've lectured for the MS Society. Women who have osteoporosis. So it's about transitioning people and allowing them to manage their health through a reasonable exercise program that they can do at home or they can do at the gym. So it's a support for them.
You must have a tremendous knowledge of the human body to be able to treat that range of maladies.
Well, you do need to be informed. I do a lot of reading, and you do continuing education. So I specifically pick the continuing ed that is for orthopedics, metabolic disorders, gastrointestinal, things that will influence how I am able to help somebody manage their health care.
You're an exercise professional. For all the baby boomers watching, how would you advise this demographic to prevent injury and to manage their injuries?
I think there's two parts to that, Leslie, and that's a wonderful question. What I would suggest to most people is they do not ignore pain. Something that starts as little in their knee and their foot and their lower back, it's not a big deal. Just moving along, and it increases. So I think one of the primary things is to not ignore that nagging little pain that you may have. Secondly, I think everybody who knows me that I'm a big person on what we wear on our feet. I think that influences the structure. If you remember the old song, the shin bone's connected to the thigh bone, what we have on our feet and how they're supported is another issue that I think is important to stress with people. So it's about not ignoring the little pain that you're having that may become bigger and paying attention to what you're wearing on your feet.
What transpires during a patient's initial visit with you?
Well, the initial visit can last anywhere from an hour to 2 hours. I tend to have people referred to me that have a complicated health history. So initially it is fact-finding. What's their past medical history, medications that they're on, any relevant radiology tests that have done. I'd like to see MRI reports and their radiology reports within 2 years. We discuss what their goals, why are they here, why are they seeing me? Then becomes the fun part. We start to get down to what I do best. I love to watch people walk, and I make them walk and walk and walk. I have a nice big space, and I can see how they're walking and what we need to address. So initially it's fact gathering, it's watching them walk, and then I start the evaluation. From either feet up, I'm doing testing on whether muscles are very tight or whether muscles are very weak, and how they're influencing the joint or joints that we're discussing, or other things that we need to talk about. So if you have knee pain, I'm looking at the weakness in your hips. What are your feet telling me? How's your posture? How do you move through space? Lots of people say to me, can you make my golf game really good? And I'm like, well, maybe next year, but we're going to work on it. So people have those kinds of goals other than getting out of pain. They want to remain vibrant and alive. So pain can really erode that. So it's a long appointment.
Yeah, I was going to ask you, how many sessions does the average person need? Do they come for a long period of time, or?
It really depends on the individual. Sometimes if it's a teenager, it's usually wrapped up in a couple of visits because they're young and they're able to heal very quickly. Most of the people who see me with arthritis, I'm dealing with one joint, the initial joint that's injured, but then kind of globally is spreading out. So at the first appointment, they will get a set of basic exercises that they need to start, which they're going to be doing daily. Everything goes into a folder. I've been known to drag out anatomy books to show them what's going on. So as far as how many appointments someone will need, it's up to the individual, and it's about the complication of the injury and what their goals are. If you want me to improve your golf game, you're going to have to give me a few more times. But typically, it can vary between just the one initial. I have many people who will see me to continue to see me over the years. I have one gentleman who I had helped with a disc herniation 10 years ago, 12 years ago. He still checks in with me quarterly through the year, just to make sure everything's going really well and to maybe change or alter what he's doing right now. And maybe he has a shoulder injury then or whatever. So it can vary with everybody.
So what would you say is the main focus of your practice, if you had to summarize?
I would say the focus is looking at the variables that are affecting the injury. And that could be as simple as shoes, orthotics, what you're doing at the gym, what you're not doing at the gym. What can we reasonably take away other than your we can't take away your genetics, and that's always a huge variable. But what can we remove? Your workstation, can we change that for you? Can we manage I can teach you how to get upstairs better, out of a chair better. Let's think about it. Let's do it this way. So I think that's the biggest focus, looking at what works best for that person. The exercises typically are the same for most people, but the approach is different. So if you're concerned about watching your grandchildren every Friday, how to get that little one out of the carrier, out of the stroller, we've got to work on that. I'm still working on her back pain, and she's still doing the exercises, but we need to facilitate that because that's very important to her, isn't it?
Yeah,
it is. It's very important.
I'm very impressed that you can take a patient who's in pain and has issues, it could be, anyone who's had a backache knows that when your back hurts, it's hard to move. And how you can use exercise to actually heal them. It's really wonderful.
It's not so much healing. I would have to say it's more about management.
Mm-hmm.
What are you doing that we can change to take the load away from that back? How do you sit in your car? How do you sit at your desk? How do you brush your teeth?
Mm-hmm.
I mean, I help people figure that out. So we can manage back pain. When I need to refer out, I definitely refer out to I have a large referral bank, whether it's orthopedics or podiatry or chiropractic, so that I can draw on their resources too to help me do a really good job for this person to manage their back pain or their knee pain or whatever they've seen me for.
Well, I'm very happy that right now we actually have one of your clients with us, and we're going to see how you manage somebody who has an issue and facilitate healing.
Perfect. I'm looking forward to it. This is Candace Cook. She has been one of my clients for 2 years, and she was referred to me by a woman down in Sturbridge, Mass. For right shoulder pain. Candace has arthritis, but primarily the first referral was for her right shoulder. Candace, just to give you a little background, is also post-stroke from 7 years ago, and so there were the complications of neuropathies, neurological problems also that we had to deal with, but she saw me first for her right shoulder. So Candace presented with pretty much typical posture of most people. She also had this cute little ace bandage on her right knee that I told her to remove immediately. I think I asked her what she was doing with it. Yeah. And so here we started with Candace, because I always start with people seated and just kind of go through a postural check. Candace would have a forward head position, and I think we see people driving like that and sitting at their desk all the time. That puts an incredible load on your cervical spine. And if you have arthritis, you probably have it in your spine. She has rounded posture, which makes the postural muscles really weak, and a lot of people suffer from pain through here, and that's because these muscles are too weak to hold her upright, and these muscles up here get really grumpy from the forward head carriage and being up and forward all the time. And this also erodes the lower back, her back extensors. So with this kind of posture, you're really kind of derailing and creating more injury. Really wearing the shoulder joints out, and then conversely the hips, the knees, and the feet, etc. So we're working our way down, and then we can work our way up to create injury or sustain and maintain injury, especially if we have arthritis. So when I'm going through this, I would sit Candace up like this. Okay, and this is good posture. This is called good scapular stability. Her head retracted back, so the little muscles in the vertebrae are turned on, and I can feel her lower trapezius. So for everybody who sees me, one of the exercises we do, and you take a band home with you that I give you to take home on the first visit, is called scapular stability. And you're going to do the exercise ad nauseum. I have people start off 3 times a day, 3 sets of 10. They look at me like I'm crazy, but they end up doing it because it feels better. So when she sat up, she probably felt a lot of relief through her mid-back. Once we sit up, and we draw in our tummy muscles, which is called abdominal bracing, which she just did because I could feel her back muscles kind of light up. Her back extensors lit up and are working now. So her trunk muscles, and I think a lot of people call that core, were just turned on just by doing that. So if we present with a shoulder injury or shoulder arthritis that Candace did, was it an accident or was it just wear and tear?
Wear and tear.
Wear and tear.
Mm-hmm.
And by the way, it was affecting her golf game a lot. So this was really a priority for her, other than getting rid of the pain, but also improving her golf game. So when Candace presented, we started with this. This is part of the evaluation, of the initial evaluation. And she was given the exercises. She was given some rotator cuff exercises. Now, had you been to PT before this, physical therapy? Had you been discharged?
They really just wanted to do surgery.
Okay, all right. So this is where I step in. I had forgotten that. Why she wanted to try something else and to try exercises first. So you want to do, typically a lot of the docs out there now, especially orthopedists, are looking at the conservative approach, seeing if appropriate stretches and exercises will help manage the injury or the arthritis in the joint more effectively, and giving you a longer time period before you need to have surgery, if you do indeed need to have surgery. So this is where we start. This is a structurally sound base. She got rid of the soreness in her back, and this is perfect. This is how you start. This enhances a golf game. This makes you be able to sit at your desk all day, commute in your car, do dishes. I don't know if a lot of people who see me are women who like to cook. Chopping vegetables for a soup or a stew in the wintertime is really hard work if you have back pain and shoulder pain or neck pain. So this is where we start. The abdominal bracing for me is also an initial exercise. You do it lying down supine, but you can also do it in your car. You can sit at your desk and do abdominal bracing, and it's just a tensing of your abdominal wall, and all you feel is a little tension. It's not doing sit-ups, which would be inappropriate for a lot of people who do have arthritis with their necks and their lower backs. With Candace, we kind of moved on because I watched her walk. We had gotten rid of the ACE bandage or whatever that was, and I evaluated her hips. Her hips are very important to her. They get her out of a chair more effectively. They get her up steps better. So since she was there and I see the whole person, I can't just treat parts, we dealt with her knee, and she was given appropriate stretches and exercises for her legs and her hips and her glutes. A lot of people it can just seem like, if you're picking something off the floor, it can seem very far away. How am I going to navigate those stairs? How am I going to get out of that chair? How am I going to drive to Boston? How am I going to work all day? So these little teeny exercises are sometimes all we have to do, but sometimes if it's more complicated with, say, in Candace's case, post-stroke and arthritis everywhere, we would have to do a little bit more global. So she's been seeing me for 2 years, and I think we've been doing
Amazing difference.
with a big difference.
Yeah, big difference.
So we've addressed her shoes, her inserts. We've done exercises and stretches. They haven't stayed the same for the whole entire time that she's seen me. They've evolved. She's gotten much stronger. She can do steps without being intimidated by them. And I understand her golf game is definitely getting better.
And my golf pro can't believe the difference.
Exactly.
Yeah.
Exactly.
Thank you, ladies, for that demonstration. Wonderful. Candace, can you please tell us about your healing experience with Donna?
It's been quite a journey. I've been seeing her for about 2 years, and I had the shoulder issues. I also had this knee issue. I was playing golf with my knee wrapped every time, and I would usually take a couple of ibuprofen before I teed off, and when I came in from playing golf, it hurt. And first time I saw Donna, after she looked at the shoulder, she looked at the knee, and she said, "What is that thing on your knee? Why do you wear it?" So we started to assess it, and I came to realize that really, as much as I have arthritis in my knees, I also have it in my hips. But what's interesting is that my knee wasn't the problem. My hips were the problem. So once we got those muscles turned on and working, and literally, because I'd had the stroke, my left side really wasn't working. It was just kind of going along for the ride, and my right side was doing all the work. So my right side was just exhausted. So we had to get the left side working, get those muscles turned on and working, and get the right side working properly. So things started to get aligned. Because what I've learned is once the hips are aligned, then the knees can get aligned, and then the ankles and then the feet. So it works from the ground up and it works from the hips down.
Gotcha.
So it's a huge learning curve, and learned a lot of exercises in the process and understand much more about my muscles, and I know which ones to work on to make myself stronger.
Now, we saw you do the abdominal bracing exercise. I imagine in 2 years you've done a tremendous amount of exercises. Can you describe a little bit about some of the other exercises that have been part of your healing?
One in particular I remember is called the bug. And that's where you lie down flat on the floor and you bring your knees up with your feet flat on the floor. And the idea is that you alternate raising 1 foot at a time while keeping your back flat on the floor.
And holding the abdominal brace.
And holding the abdominal brace. You want to get your abs braced, and your abs support you to do that without letting your hips move, just to raise the foot, raise the foot, raise the foot. I couldn't even do it. And then she said, "Well, listen, once you get that mastered, you're going to raise an alternate arm while you're doing them." I'm like, nobody could ever do that. Well, now I do it without a second thought.
And you do it every morning?
Not every morning, but I do it very, very often, because I really like having the ability to carry myself this way. I'm so much stronger. It's really changed the quality of my life. And I'm positive I'm going to live longer as a result of changing the quality of my life, because I can be more active, because it's easier to be active. I'm not working as hard just to go from point A to point B.
I'm so impressed. And it sounds like your golf game is very important to you.
Yeah, it is important to me. I like to play 2, 3, 4 times a week. So it's an important part of my life.
That's a wonderful story.
It is. It is.
Now, I think you have another wonderful story. I was going to ask Donna, the greatest success story of your long career.
When I thought about that, Leslie, there was a person who came to mind. He lives in Andover. His name is Norm. And he was first referred to me 5 years ago, for a shoulder injury. A massage therapist referred him to me. She's also an OT. So met Norm, and he was probably in his early 70s then. He's now 78. He just turned 78. And we came up with the same postural stuff, the same scapular stability, the same abdominal brace, the same bug, and we did the rotator cuff. And I was supported, once again, here's the team approach, by his massage therapist and by acupuncture. So Norm saw me every week for quite some time for the shoulder. And as it evolved, since Norm had arthritis in his shoulder, it steadily improved, but we came to have some other issues. Namely, one would be his lower back. Arthritis for lower backs turns into spinal stenosis eventually for a lot of people. And Norm is an avid hiker. He likes to dance, or he likes to dance now. And we were really troubleshooting it, doing all the exercises for his hip, making sure his feet had good shoes, orthotics, everything, stretching appropriately. As we do know, as we age, we become less flexible, so that was a very important piece of that, is stretching appropriately so that he didn't hurt himself further, his lower back. I see lots of people stretching ways that they could potentially hurt their lower back. So Norm had a regime. He's an Excel spreadsheet with all the exercises we had. So I knew that we needed help. So acupuncture and massage therapy, but at that point we had to call in orthopedics. And I referred to a specific group, and he saw this guy, he saw the head of spinal surgery. And so he came up with a plan for Norm, a couple shots, which was fine. It was buying us time before surgery. And so Norm had his shots, and we were really managing it well. He's doing his exercises, he's still out there hiking. We, in fact, even had to have him get hiking poles for the walks that he does in the area. Those work to a degree, and he finally said to me one day when he had his visit, I said, it's time, isn't it? And he's like, yeah, it's time. So I said to him, you're going to go into this surgery so prepared. All your muscles are turned on. They haven't stopped working because you've been making them work this whole entire time. So you've been well supported. I said, here we go, time to go. And so he had his surgery 2 years ago this August. And I said to him, you have done your homework. I promise you, if you do everything I tell you to do after, I'll walk the Feaster 5 with you that year. So comes that November, and his daughter was with us, his granddaughter was with us, and Norm and I, so we walked it. Norm was so fast, I cannot tell you, had no back pain whatsoever. He was like, I could barely keep up with the man. And we walked the 3.1, and at the very end, my husband happened to show up too. He had run the 5-miler, and we all crossed the finish line together, and I cannot tell you how special that was.
So just so that I'm clear, he went from hardly being able to walk
Yes.
to walking a 3.1?
Yes, without pain, and he still has no pain anywhere. So now he sees me about every 5 weeks. We check in, make sure everything's good. He's good, and then off he goes.
Fabulous.
It is fabulous. He's very special. Everyone is very special, but he just paid attention.
Now there's something I'm dying to know for myself. So you've had these marvelous results through exercise. Now people come to you, they must bring up diet as part of, their overall wellness. Do you get involved with that part of the program?
It depends. On occasion, if we're dealing with a type 2 diabetes, metabolic disorders, osteoporosis, maybe I might refer out to nutritionists who specialize in either one of those. But since I love to cook and I love to eat healthy, and I cannot tell you, I always tell people you are your genetics, but you are what you eat. So I will have conversations with people on what to do with that kale that they don't know what to do with, or how to make a delicious stew out of beans or something like that. And I've been known to share recipes with people. Norm would actually got my roasted kale recipe, and he really, really liked it. It can be challenging with kale. So yes, I enjoy it, so I will certainly share any knowledge or recipes that I happen to have.
Excellent. Now, you also mentioned that you read the Journal of American Medicine and do a lot of research. Are there any little pointers that you can leave us with in terms of your research?
Well, every morning I receive abstracts from the New England Journal of Medicine and other journals, so I get specifically orthopedics, women's health, gastrointestinal, and a couple others, nutrition. And I scan them, and if I need them, I print them and I hang them in my lobby, or they may come up with a conversation. A lot has changed, for instance, with vitamin D, the importance of it, too much, too little, it's still kind of unknown. And then calcium supplementation has changed a lot. A couple of months ago, they were saying we were taking too much, and a study just came out this morning and said we weren't taking enough now. So everything's in flux, but I need to be very informed so that if you ask me a question about calcium, I'll be prepared to answer it for you. So I don't recommend supplementation, but I can discuss what's going on with it.
Oh, I was just going to ask you that. You read my mind. I wanted to know if your patients asked you if you recommended vitamins or supplements as part of their overall.
That is not within my scope of practice, but I am certainly able to have a conversation about them, since I do read about this every morning, pretty much. And I think for me, it's personal because I'm taking care of my health, and I like sharing my knowledge with them. It's very important to me.
Fabulous. I can't thank you both enough for coming here, especially you, Candace, for letting us tell your story about just the incredible improvement you've made with Donna's care, and I can't thank you enough.
Well, we thank you, Leslie. It was a pleasure to be here today.
Thank you. I enjoyed it.
Wonderful. Thanks for being with us on Boomer Being. See you next time.